Hello, I'm Ocean Lifeguard Ryan Makuta, and today I'll be giving a presentation on how to perform a patient assessment. Patient assessments are very useful because here in LA County we perform them thousands of times per year in order to treat our patients. So, let's get into it. First thing you want to do for your patient assessment is when you step on scene, you want to make sure the scene is safe. So, that includes having your personal safety, which means you must have the proper BSI or body substance isolation. When performing a scene size up, you want to make sure that you're safe, your patient is safe, and your partner is safe. You want to make sure that there are no environmental hazards, especially here on our beaches, which can include the ocean. If our patient is wet, we want to make sure that they're dry. We want to establish the number of patients. Are we dealing with one or are we dealing with multiple people? You also want to assess the mechanism of injury or illness as you step up on scene. You want to request additional resources if you're going to need them, and also make sure that you treat for C-spine if you need it. Going into our primary assessment, you want to get a general impression and treat any life threats. So that means if you come up on scene and there's an immediate life threat, you want to treat that right off the bat. You also want to determine responsiveness, which includes determining if the patient is alert, if they're verbal, if they respond to pain, or if they're just unresponsive. If your patient is unresponsive, you must check their breathing and circulation right away. Continuing your primary assessment, you want to go through your ABCs. That includes your airway, and you want to make sure that it is open, or if it's obstructed, you want to remove the obstruction. You also want to check the breathing, which includes the rate, rhythm, and tidal volume. As you check for circulation, you want to check for a pulse, or you want to check for skin signs, the capillary refill, or check for any signs of bleeding. You also want to check for any deformities, expose the body if you need to, get a good field impression, and decide if you need to rapid transport or you can treat the patient in the field. As you finish this up, you would want to perform a rapid head-to-toe assessment. Going into your secondary assessment, you want to get your OPQRST, which is your onset, how did this event happen, your provoke or palliate, meaning does anything make it feel worse, or does anything make this feel better? You want to assess the quality of pain. So, is it crushing? Is it stinging? Is it sharp? These are the information that you want to gather. You also want to check the region of where the pain is coming from. So if someone says, my chest hurts, there you go. You have where the region is. But you also want to check if there's any pain anywhere else, because that might be the center of pain. He might have pain somewhere else that you can't see but he's feeling, but one is just taking over. You also want to know if it's radiating to any other part of his body. You want to assess the strength. A good way to do this is to ask, hey, on a scale of 1 to 10, how bad is the pain feeling to you? You want to assess the severity and what time that it started happening at. Continuing secondary assessment, you want to get a history of this person. You want to ask them questions such as, do you have a history of any type of any problems that we should know about? Do you have any allergies that we should know about? Or are you taking any medications that we should know about? This is all important information to gather when treating your patient. Part of getting your secondary assessment is to include vitals. This is very important. What we include in vitals are blood pressure. You want to assess their eyes, so you get a light shining in the eyes, assess the pupils. You want to get lung sounds. You want to assess their levels of consciousness, skin signs, respirations, check their pulse. And now that we have pulse oximeters in the field, you want to get an SpO2 as well. As you finish up your secondary assessment, now you want to get into a detailed head-to-toe where you check your head, neck, lung sounds, abdomen, pelvis, extremities, and don't forget the back. As you assess your detailed head-to-toe, you're also looking for any deformities, any contusions, any abrasions. You're looking for any punctures or penetrations, lacerations, tenderness, or swelling. We like to call this the DCAP BTLS. And you also want to check for tenderness, instability, or crepitus. As you complete your assessment and you treat your patient, you always want to reassess your patient. Once you get a good treatment for your patient, this becomes a new patient, so you want to go through your ABCs again, make sure everything's in check, finish up a secondary reassessment. And you also want to reassess vitals every 5 or 15 minutes depending on the severity of the injury or illness. That concludes my presentation. My name is Ryan Makuta, and I hope you enjoyed.